Let's talk about most common causes of hand pain. So number one is carpal tunnel syndrome, which is a most common nerve disorder of the hand, which is caused by compression of the median nerve. So now a lot of times my patients tell me I have tingling and numbness in my hand, but not all the time the tingling and numbness is carpal tunnel. Sometimes it's coming from your neck too. So it's advisable that it is ruled out by your doctor or your physical therapist where it's coming from, because the treatment will be different. And the way I describe this as, when you want to have fruits or flowers on the tree, you don't water, you don't put fertilizers at the branch, at the leaves where you pluck the flowers or fruits. You actually water at the roots. Same way, when somebody comes with the neck pain and pinched nerve at the level of the neck, whether they'll have tingling and numbness in the hands, and they'll be like, why you're not treating my hand, you're treating my neck. But that's the root, that's where it's compressing, and that's when I need to decompress, and that tingling and numbness in the hand will be relieved. So in carpal tunnel, which basically happens in pregnancy, sometimes diabetes, wrist fracture injuries, but you will feel tingling and numbness. But what differs is the thumb, the index finger, and the second finger. That fingers you'll feel more tingling and that's this distinguished feature of the carpal tunnel, and it's not the nerve root compression from the neck too. And there are some differential diagnoses we do for that. But that's number one, why you would have tingling, numbness, and pain and at your wrist, and tingling, numbness in your fingertips. Another common cause for hand pain you would see is Dicker-Weiss syndrome. And in that syndrome, you would feel the pain around base of the thumb and sometimes extends down to your forearm. In Dicker-Weiss syndrome, the tendon of the hand finger muscles, they get inflamed with repeated injuries or overuse. Sometimes you would see this in new mothers carrying their baby in the wrong postures or manner, or wrist fractures and things like that. The treatment for Dicker-Weiss syndrome should include splinting and resting. Compared to other hand pain, you need to move and exercise more, because this happens with overuse of certain tendons. So you want to rest your hand and not do those repeated activity, which may cause repeated injury and Dicker-Weiss syndrome. So there is a self-assessment tool you can use to determine whether you have Dicker-Weiss or not. So for that, you put your thumb inside your fingers and make a fist. Make a fist and bring it down, that movement. Bring it down, and if you have pain here, around the thumb, even upper towards your forearm, then it's a positive sign. So the name of the test is Finkelstein test. Another very common condition you see a lot is trigger finger. So in trigger finger, the finger is either bent or straightened, and it feels like it's locked in that position, and once it's like that, you can't straighten it all the way, or if it's straightened, you can't bend it without pain. So what causes trigger finger? So the tendon of the fingers, they glide through a tunnel, it's called sheaths. So the inflammation of that sheath causes trigger finger because of overuse. Trigger finger is commonly seen in certain occupations like farmers, musicians, or industrial workers. It's very common around the age between 40 or 60, and more common in women than men. And number four, and the most important one, the one we were waiting for, is arthritis of the hand. Whether it's osteoarthritis or rheumatoid arthritis, it makes your small joints of the fingers painful and stiff, especially in the morning or with no activity. So what happens with inactivity in both type of arthritis is synovial fluid decreases around the joint. So the lubricant that keeps everything smooth. So less synovial fluid, less lubrication, more erosion at the joint. Math is simple. That's why we say movement is ultimate key. Motion is lotion. The more you move, there's more fluid around the joint, and then you have better movement, less pain. So there's common misconception that when you have RA, when you have arthritis, I should use my hands less. No, because that will cause more inactivity, less synovial fluid, more pain, more stiffness. So remember this golden mantra, motion is lotion, you want to keep moving. So what happens in rheumatoid arthritis? It's an autoimmune disorder where your immune system mistakenly attacks your own body's tissue. And that involves multiple joints, even systems, heart, lungs, all that as well. But here we are talking about just hands for today's topic. The difference, instead of the osteoarthritis and rheumatoid arthritis, affects the lining of your joint. Osteoarthritis affects the wear and tear kind of arthritis, affects the joints, but this affects the lining of the joint. It's mainly seen in women more than men, and this affects any age basically. But family history, smoking, overweight, those are some of the factors that really affects getting more chances of getting RA and more deformity as well. One interesting fact about RA is about 2/3 of people with RA are overweight or obese, and that can worsen the RA as medications are less effective. See, fat doesn't just take up space in your body. It's an active organ that releases hormone and then it affects glucose metabolism, but releases cytokines, which is a protein that causes inflammation in the body throughout. There was a study in 2018 that showed people who were obese, BMI 30 or more, with RA became more disabled much sooner than even those considered overweight, BMI between 25 and 30, both with RA. When I talk about osteoarthritis, the wear and tear, the weight affects a little differently. For example, for my knee patients, I tell them the ratio is 1:3. So every 1 pound gain of weight affects 3 times. It puts 3 times pressure on your knee. So the weight affects with more wear and tear in the osteoarthritis. But here in rheumatoid arthritis, the mechanism is different, but it affects it as well. So the difference between overweight and obese is the overweight BMI is between 25 to 30, and obesity starts like 30 up. So once you have RA, most people think that once you have it, you can't reverse it, so there's nothing you can do about it except medication. But there is a research by Arthritic Care and Research Department in 2016. So people with hand RA specifically, and people who had regular treatment with medication and all the traditional, versus people who had hand and wrist exercises, found more improvement in the grip strength by 4 months and predicted improved hand function at 12 months. And what also can happen as RA progresses, there's remission stage, and so when it progresses worse, then you see more deformity in your hand, and you can prevent it by doing these. Most common deformity of hand RA is ulnar drift, which happens after the chronic inflammation from RA. So as we talk about how exercise, movement, physical therapy can help prevent getting the symptoms worse for RA, lifestyle and food is the main factor. So I'm going to talk about 5 most effective food that you can eat for preventing RA symptoms. There was a research done in Cleveland on effect of green tea in RA, and then they found there's a substance in green tea, it's called EGCG, which stops the production of the molecule that leads to joint damage in RA. So this specifically works on joint damage in RA. That's why start drinking green tea. Another popular and most beneficial source is berries. Strawberry, blueberry, even pomegranate, they all are very rich in antioxidants. And there was a research done on that as well. As little as 2 servings a week decreased 14% of symptoms in RA patients. So having 1 serving a day would be wonderful. Another wonderful source is fatty fish. Salmon, tuna, they're all rich in omega-3, which really helps in RA as well. Number 5, and my personal favorite, is turmeric. Turmeric looks like a ginger root almost, and the powder form is more famous in Indian spices. They use that a lot. You might see that in the market. It's like mustard yellow in color. Another source for my vegetarian friends or people who can't have fatty fish, nuts is another good option, especially walnut. So soybeans, cashews, almonds, but especially walnut, they're all rich in omega-3 as well. So load up on your omega-3s, that really help. In ancient India, before the medicines were invented, they used to use turmeric for various reasons. They'll put turmeric on open wounds so it wouldn't infect. They would use it for cough. They would use it on brides on the face before their weddings to have a nice glow on the face as well. So turmeric has a big part on arthritis and prevention and pain as well. The Arthritis Foundation here, they recommended a dose on turmeric capsule around 400 to 6 milligram 3 times a day. Or if you're taking in a powder form, then half to 3 gram every day. And this is just suggested by Arthritis Foundation, and you can ask your doctor about it. I know one of my patients told me about if there's any effect on if they're taking blood thinner. You can ask your doctor about it too, but if you just take in a moderate amount, it should be fine. Sometimes I would get questions like, oh, I have knee arthritis, can I do yoga? Well, it depends. Can I do this exercise class I'm going to? There are various exercises they will do or the yoga positions they might have, but always have a goal in your mind. For example, I ask my patient 3 things not to do for knee arthritis: twisting your knee, stairs, squatting kind of position. So now when you do any yoga or do any exercise, be mindful of that. Any activity or exercise that requires twisting, you skip that or be mindful of that. So similarly, have a goal in your mind before you do any exercise. Before I start showing you exercises, let me make it clear that the exercise you do should have a goal, and it should be specific to that goal. Then only it will be helpful. For example, I have patient with the back pain and I ask them, do you exercise at home? And they're like, yeah, I go for a walk. Okay, going for a walk is not enough because you didn't do specific exercises and stretches for the back, and therefore in your mind you think I did exercise but my pain is not better because you didn't do specific exercise for back, and that's why you don't see result. So always have a goal why you would do certain exercise and why you would not. So here for hand exercise, your goal should be every joint and muscle of the hand should be moved. So how many joints you have? This, 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 at the wrist. So when you move them, then only you would prevent getting it stiff, more synovial fluid around it. So I often say this to my patients, use it or lose it. So whether it's your joint range of motion, whether it's your muscle strength or any function that you might have in your body, that if you don't use it now, eventually you lose it. So let me talk about most common exercises you can do, 5 most important ones for rheumatoid arthritis or any hand pain or arthritis you might have. Number 1 is open and close. But when you open, spread them apart as well. Open and then close all the way and make a fist. Open and close. Number 2 is make an O. So with your thumb and your fingertip, like this, you make an O. But there's a modification that I do. From here, you go here. So then you bend your interphalangeal joints here and make an O and then go back like this. And then you repeat that with every other finger. Number 4 is a nerve stretch. You clasp your fingers together, then you turn your wrist and your elbows around, and then you extend your elbows like this. And then you go up as high as you can and bring it back down. Again, clasp your fingers together, turn it around, stretch your hand, stretch your wrist, your forearm, and bring it as high as you can go comfortably. If going higher causes more pain, you can limit going higher, but you want to do this stretch even back and forth. That is a nerve stretch, so you actually can benefit from stretching different muscles around as well. There's a kind of yoga for hands which is called mudras. Mudra involves specific hand positions, and there is significance of each position, and that helps with certain elements in the body. I'm not going to go over in the detail in this video. If you want me to make another video for mudra, let me know in the comment below. One of us will make mudra video specifically. Anyway, so out of all the mudras, there is one specific one that's very significant and related to our RA, which is called Vayu Mudra. Vayu in Sanskrit means air. So the gas in the body releases by doing that. That's significance of it. But they believe that also is associated with arthritis. So doing that actually helps with arthritic pain as well. So for that, you bend your finger, and then here in the middle part, you press with the thumb, with the pressure, and you hold it like that. And they recommend this doing anywhere from 15 to 45 minutes. It will be a little bit uncomfortable and painful. Don't push it too far, but little painful is expected. But then they will release the tendon, release the pain, and it will help overall. If you liked the video, please give a big thumbs up. If you have any questions or comments, please write in the comment below. We will really answer it as fast as we can. And if you want us to talk about any other health topics, please write that in the comment as well. Our number is 469-212-8888, and our website is surecurewellness.com. Alright, so I hope you found this video very helpful and thank you for watching. Again, my name is Neeti and I'm Doctorate of Physical Therapy at Sure Cure Physical Therapy and Wellness.